The Oakville Virtual Care Program was set up in 2019 to address a significant deficiency in how we provide care. As you know, in healthcare, we provide care in person. So if patients have questions, if they need to see a physician, they need to come and see the physician in person. Sometimes that's not the best way to provide care. The objectives of the Oakville Virtual Care Program fundamentally come down to two issues. How do we provide optimal care to our patients, and how do we provide optimal experience to our patients? And the challenge in the conventional model is that the hospital or the physician's office is open between a certain time, and patients need to accommodate to that. There are challenges in transportation, challenges in the need to get time off work, childcare. Access is a big issue in healthcare. So being able to provide virtual care has had a tremendous impact on my ability to take care of patients. One of the changes we introduced is what I like to call our post-operative day one program. When we talk to patients on the day of surgery, it can be very challenging for them to remember all of the details of the conversation because of anesthetic agents, because of pain medication. Patients often have questions the day after surgery, and as you may imagine, having had surgery with restricted mobility and with pain, that's not a good time to be traveling to see your physician. That is the perfect time for virtual care. So we started a program where all of my patients the day after surgery have a virtual visit with me so that I can assess their response to surgery, how they're responding to our pain medication, answer their questions, and really ensure that they have an optimal patient experience.
You're thinking the idea of getting into a car and going to a doctor's office the day after surgery had no appeal to me. If I wouldn't have been able to do this virtual visit, I wouldn't have had access to Dr. Rosario at that time. So to me, it was a game changer. I was reassured. So if I think about my conversation with him, I was able to ask any questions, he was able to answer them, and I was put at ease. And that wouldn't have happened if I didn't have access to Reacts.
Reacts has a call model. So when I'm ready to provide a virtual visit to a patient, I select their name on the screen and I tap call. Consumers are used to this. Interactions are very simple. Patients understand the workflow and understand the use of the application very well, and there has been tremendous adoption from our physicians. I was reviewing your latest reports, and I see that everything has come back absolutely wonderful. Got no clinical concerns at all.
Excellent. That is great news to hear. Thank you. From a surgical perspective, I'm feeling great. This scar has healed very well. I'm going to say you are masterful at what you do. Thank you.
If I need to examine a patient, if I need to operate on a patient, of course I need to see them in person. But if I'm talking with a patient, delivering news about imaging, pathology, or lab test results, if I'm having short interactions with patients or discussing surgery that is upcoming, a lot of these interactions can be done virtually. And a virtual interaction saves the patient a tremendous amount of time.
I'm going to say everybody has 24 hours in a day, and time is precious. So if I can actually save commuting time and get the same quality healthcare via video conference, that's a huge benefit.
So on a fundamental level, we have the ability to provide a lot of the healthcare that we provide virtually with the same level of quality or better levels. One of the real challenges we have in healthcare is the inability to collaborate with all of the healthcare providers in our patient circle of care. One of the big strengths of Reacts is collaborative patient care. Multiple care providers on Reacts can communicate in a secure and safe fashion about patients and securely share reports and images to provide true collaborative care.
I would love to see this program expanded to other elements of my healthcare as well as friends and family. I understand that there is definitely, from a testing perspective, there is a need to be in person. I also think there's a huge opportunity to take advantage of a program like Reacts for so many other elements of healthcare.
We need to provide this wonderful tool to all of the caregivers in our community, and not just physicians. Nursing staff, nurse practitioners, physiotherapy, pharmacists, all of the wonderful caregivers in our community need the ability to interact virtually with patients. So on a fundamental level, we have the ability to provide a lot of the healthcare that we provide virtually with the same level of quality or better levels of quality. We need courage as healthcare providers, we need courage as institutions. We need the courage to recognize that we have the solutions that we need in front of us.